I'm Dr. Ocampo. I'm with SportsMED. I'm going to be showing you some simple stretches today for plantar fasciitis and some massage exercises that you can do as well for plantar fasciitis, and a taping technique called low-dye strapping that is also used to help control plantar fasciitis symptoms for runners and walkers. So I've been in practice for 23 years in Huntsville, and hopefully these videos will help you. This is a dynamic stretching strap. It's used for treating plantar fasciitis. Essentially, this is used to stretch your Achilles. So it's not a stretchy strap, as you can see. You can get these online. They're typically around $10 to $15. What I like is for people to put it at the bottom, at the ball of the foot, and then find a comfortable position with the loopholes where you can really get an effective pull. And you want the second toe lined up with the shin, the front high part of the shin. So sometimes you have to turn your foot in. You do not want your foot out here when you're pulling back. That won't help you as much. So you really want your second toe lined up with the shin, and then pull back on the foot for about 20 seconds or so, and repeat that about 20 to 30 times a day. The other thing to make note of is you want your knee perfectly straight. If you bend the knee, that reduces the pulling effect on one of the muscles that make up the Achilles. So the majority of people that have plantar fasciitis, many of them have it from a tight Achilles. So you should have at least about 15 to 20 degrees of bend at the ankle, which we have right now. So if you are pulling your foot back and you only see, about a 90-degree angle right there, that's not enough. That means your calf is too tight and you need to work on that flexibility to be able to pull it back. That pretty well does it for the stretching exercise for the Achilles. If people want to get a little more of a pull, you can go to the very back of these loops and lay down and use your body as leverage to pull on the strap if your arms are getting tired doing it. So you don't necessarily have to pull with your arms. The next muscle group I like to stretch for plantar fasciitis is the hamstrings. I know that seems a long ways off from the plantar fascia, but many times the overtraining will cause a tight calf and tight hamstrings. That can cause altered gait, which typically lead to the overuse injury of plantar fasciitis. So to stretch the hamstrings, we use the dynamic stretching strap and keep the foot pulled back, just like you were stretching your calf. Find a comfortable position where the loopholes are on the stretching strap. Go ahead and find one anywhere you want. And you're going to lift the leg with the strap as high as you can go. And again, you want to try to achieve about a 90-degree angle to your body. The other thing to make note of on that when you're stretching, if there's tight hamstrings, some people find it easier when they turn their leg out to the side to raise it up higher. I don't want people to do that. I want you to keep your foot pointing straight in line with the rest of your body. And that's something I think that's important to make note of. And you do the same type of hold, 20 seconds, and repeat it about 15 or 20 times. This next exercise is also for plantar fasciitis. It's deep tissue massage. It helps with increasing blood flow to the plantar fascia, and it helps push your body past that chronic inflammatory phase. You typically do it for 2 minutes, and you need to actually make it hurt. And what we do, cross your leg, pull your toes back. That creates tension on the plantar fascia. And you can either use a massage device or your thumb, and push your thumb as hard as you can right at the base of the heel, kind of on the inside part, just at the beginning of the arch. And really get in there and do circles to push and massage the fascia. And it should kind of hurt for about 2 minutes is all you want to do that. That's the most I would recommend. So stay concentrated, and you can feel that little band coming through the arch. And that's one way to do deep tissue massage. The second way to do deep tissue massage, which works okay, I don't think it works as well as pulling your toes back like I showed you in the last video, is using a hard rubber ball. This is a dense, hard rubber ball. You put the ball on the floor and you push with your leg and roll it round and round for, again, 2 minutes. Some people can actually handle standing up on the ball and rolling it around, but I think it's probably safer just to sit on it and do it for 2 minutes a day. These balls are available typically at a sporting goods store. It's not a hollow ball. This is actually a lacrosse ball. Typically it has to be a solid core type of a ball, not a tennis ball. This next technique is called Lodi strapping. It's to help reduce tension from the fascia for running and walking. It typically is done before a walk or a run. Take the tape off right after. It's good for maybe an hour or two. And here we go. So if you cut some different strips of tape, get the length. I typically will put the non-sticky side like this just to get my length proper. You want 3 strips of tape going from the ball of the foot from this area all the way around the heel to the ball here, and then you're going to use 3 more strips of tape running in that orientation, and then you're going to see how we put them on. So we'll start with the first strip, and the important thing about this too is positioning the foot properly. So typically you start with the tape right there and run it along the heel, and I try not to get wrinkles in it because that won't be real comfortable. So once you get it around the heel, you want to grab the foot and bring this part of the foot, make an arch, bring that part down and stick that down like that. If you have any excess left over, you don't have to leave it on the toe. You can cut that later. So then we're going to do a second piece. Once this is stuck down, this is not real pretty. And this one is going to start from here and go up like that. And I usually basket weave these. I keep them together. So this second piece again comes down around like that. Bring the foot down every time you do it, and I stagger it slightly into the arch. This one goes slightly in front of the other one. And then the third one goes again right to that 5th metatarsal head. And while I'm doing it, I'm keeping the foot kind of rotated in a position that maintains an arch. That's reducing the tension in the fascia. And the last piece goes down here like that. So that keeps this part of the foot down, so when she actually stands on that, it should feel like it has a lot of stability in the arch. And that's it. And then the whole piece can be peeled off after a run.